My name is Dan Straughn. I'm the Executive Director and the founder of the Homeless Alliance. We run this campus for homeless services. There are 3 elements to the campus. We have, this is our resource center. We have professional staff, pharmacists, physicians, case managers, mental health providers, substance use treatment people, employment, training, and placement people from 31 different government, faith-based, and nonprofit agencies, all co-located on this block, along with our day shelter, which serves about 300 people a day. And then we have housing for homeless veterans and for chronically homeless people on the east end of the block. So one of the things that's important to understand about people who are homeless is it's never one thing. You know, it's never, I lost my job and so I'm homeless. If it were that simple, then just finding that person a job would address their homelessness, right? So, but it's not that simple. It's, you know, I lost my job because I drink too much, and I drink too much because, you know, I'm a Vietnam era veteran and I got service-related PTSD, but I have a less than honorable discharge, so I can't get treatment for it. And between the PTSD and the drinking, I've wrecked my physical health, and I can't get primary health care for me, although I can get it through Sooner Care for my kids. And because that's been going on in my life for the last 5 years, you know, I've got an eviction on my record, and now even when I have a job and when I have some money, nobody will rent to me. And because that's a really frustrating way to live your life, I've lost my temper inappropriately a couple of times, and I've got a record. So there is no single agency that can address all those issues. So what you have to do is you have to bring a bunch of agencies together to provide the wraparound services, the mental health care, the PTSD treatment, the substance use treatment, job training and placement, and the housing piece. And then you need some agency to kind of coordinate that. That's what we do. And that's what's so frightening about these state budget cuts is all that mental health care and substance abuse treatment that's outpatient stuff, right? So when the Department of Mental Health says we have to cut all outpatients, we're just going to do, as Commissioner White said, meds and beds. So the outpatient stuff, the helping that homeless person with their mental health and substance abuse issues in order to get them into housing and stay in housing, we lose that. So our coordinated case management team for homeless single adults has 22 case managers from 19 different agencies. We'll go from 22 case managers to 9 for our single adults. We have 7 case managers from 6 different agencies. For our homeless families with children, we'll go from 7 to 2. Our coordinated case management team for homeless youth will go from 13 to 4. So we've been housing 50, 60, 70 people a month with this team approach. We'll go down to maybe 10 a month. Inflow in Oklahoma City is about 50 a month. So we'll see homeless numbers rise simply because of these state budget cuts. And the state budget cuts aren't funding housing, they're funding the case management that lets people stay in housing. The other thing that the state budget cuts is really going to impact is many of our partner agencies have federal grants that they use for the housing, and they use their state grants to do the case management. All those federal grants require a cash match. And what those agencies have been doing, North Care, Hope, Red Rock, have been using their state grants as their cash match for their federal grants. If you don't have the cash match, the federal grant goes away. And once Oklahoma City, Tulsa, Norman, state of Oklahoma loses those federal grants, you can't get them back. They're based on a per capita of what you did last year. And so if you kiss off $1 million in federal housing grants for Oklahoma City, that's $1 million that's gone for good. We won't get those back once the legislature fixes the budget, assuming they do. So that's why it really is a super time-sensitive issue, not only because people that are formerly street homeless with serious mental illness that are now housed through those programs, they're going to lose that housing. They'll lose their case managers and they'll lose that housing because the grants go away. Just one agency, Hope Community Services, 127 formerly homeless, mentally ill. December 1, that goes away. Oklahoma City's point in time count, and any given night, the total number of homeless is about 1,300. So from December 1st to December 2nd, that's a 10% instantaneous increase in our total number of homeless. And then agencies like mine, even though we don't have any state grants, we'll see the impact in the number of case managers we have here on site, and more importantly, in the numbers that we serve in the day shelter and the acuity of the folks that we're serving. Because these homeless people served by PAC teams, the Program for Assertive Community Treatment of the Homeless, partially funded by state grants, those services go away. And so people who have serious mental illness and addiction issues that are on meds and in treatment will lose those meds and treatment. We'll see them in the day shelter, and their behaviors are going to be that much more challenging to control. And so, you know, for years, Sheriff Wetzel called the Oklahoma County Jail, City County Jail, the largest inpatient mental health facility in Oklahoma. You think it's bad now. In 3 months from now, if these budget cuts go through, it'll be 10 times worse.
What happens to the people? You said 31. The next question I want to is 31 entities, faith-based, nonprofit, et cetera. How many of those would be impacted by cuts? The second question would be, and what becomes of these people? Entities that wrap around here, state budget cuts go through, there's no guarantee they'll get it done by December the 1st. What happens to those entities that are providing the services?
Sure, so all the community mental health centers, and we have all of them here, North Care, Red Rock, and Hope, those case managers are funded through those outpatient services, and that's what's going away. So we'll lose all our mental health professionals, all our substance use treatment professionals. The federal into the VA is here. That's not going to be impacted. But the thing is, though, this team approach that we have of providing wraparound care, when we lose significant parts of that team, even though the VA is not directly affected by that, all the veterans that we have in housing are getting services from other members of the team. Because when those services go away, those veterans who are in housing become more precariously housed, and those veterans that are waiting for housing, it's just gonna extend that wait that much longer because it won't be stable enough to get into housing and sustain it.
Will this be happening all over the state?
Absolutely, all over the state. Tulsa's affected in the same way that Oklahoma City is. Norman's affected. Ardmore, Lawton. I mean, we're hearing from all of our partners, and part of the problem is you know, if God forbid a big community mental health center like Hope Community Services suddenly disappeared, you know, we have all these other agencies that could maybe come in and fill that gap. But with these across the board cuts to DHS, the Healthcare Authority, which is providing advantage waivers, and Department of Mental Health, there isn't anybody you can fall back on. You can't say, okay, well, Hope's going to lose $1 million in federal housing grants. Homeless Alliance, can you take those over? Well, no, because we don't have $250,000 in cash match that's required. So, and there isn't any agency that could take those over. And that's why I say you're going to lose those grants.